Hey, I'm Dr. Vanessa Allen, and I want to introduce myself as a lifestyle medicine coach in addition to my training as a family medicine doctor. I'm starting to focus on lifestyle changes because I think that's the core basis for getting the results that you need, especially when patients come and ask me, how do I get off my medicines like hypertension, diabetes, and high cholesterol? And then more recently, to treat chronic diseases like obesity. And it's with the newer drugs that are out, you have a lot more options to help you with losing weight and then preventing the subsequent chronic diseases. But then you also need help in how am I going to keep the weight off once you use your medications in order to get the weight off. So especially this time of year, a lot of people want to lose the weight. They want to start new things, want to establish a new lifestyle, want to get healthy, and I'm all for it, and I want to help you get there. But you need some tools in order to get there. So let's go back in the history of some of the weight loss drugs that have been there. Initially, there was phentermine, which is an appetite suppressant. It works on your brain to tell you not to eat so much. Initially, it was combined with another drug, but that drug had a lot of adverse side effects and subsequently was discontinued. And then phentermine has been combined with subsequent drugs since that time in order to get a more additive effect of weight loss. And then more recently, in the last, I would say 3 to 4 years, there have been a new way of losing weight with Wegovy, and then more recently Zepbound. And they work at the small intestinal level to decrease the absorption of carbs. So if you have a high carb meal like say a fast food, like say with burgers and fries and with the bread, milkshakes, things like that, you might have a hard time absorbing, and then you would feel bloated and gassy, and as a result you wouldn't eat as much. But if you ate a variety of foods like plant-based or fruits and vegetables or high complex carbs, whole grains, etc., you probably won't have that discomfort, but then you won't eat as much either. So there has been significant weight loss with those medications, which is a good thing. And then we have seen improvement in diabetes, cholesterol, and high blood pressure. But still, to get to the core of the issue is, what are you going to do when that drug is no longer available? Like with Wegovy, there was a supply and demand issue and there weren't any drugs left. Or with this new drug that comes out, again, you might run into the same problem, or you just don't know how to eat in the first place and you want to still get the weight off and keep the weight off. So my role as your health coach is to teach you some new skills so that you can keep the weight off and be able to sustain the weight for the long term. That's what your lifestyle coach can do for you, and that's what I am prepared to assist you with. So if this is something that appeals for you, I encourage you to go to my website at naturalfamilywellness.com. You can also look at my Instagram at life.way, and I'll be posting videos there as well as on YouTube. And for the month of January, I'm offering free consultations to see if this is a good fit for you and to see if that's something you want to pursue to help you with sustainable weight loss. It can also be used for other chronic conditions like diabetes, hypertension, and high cholesterol. If you're looking for a way to, how can I get off my medications and without hurting myself, or how can I get some good skills in order to prevent having the long-term effects of being on medications. So I invite you to give me a call, check me out, see if this is something that interests you, and then we can go from there. Thanks.